Hi, I'm Kimberly Corp.
And I'm Catherine Corp.
And we're here today with another episode of Let's Get WELLthy.
And that's W-E-L-L, WELLthy.
Yes, we've been in the fitness profession for almost 20 years now.
And actually over 20 years if you consider our careers as professional dancers.
Yes, and there's one issue that almost all women have at some point in their life, whether it's post-pregnancy or during menopause, and that's issues with the pelvic floor. Now, we know how we cue our clients as Pilates and professionals and how we talk about it, but
sometimes it's good to hear it from an expert. So we traveled 2 blocks down to our friend and colleague in health, Dr. Nidhi Sharma at Funk Physio Physical Therapy, and she's going to tell us more about the pelvic floor and what we all can do to empower ourselves.
So let's take a look. Hi, today we're here with Dr. Nidhi Sharma of Funk Physio Physical Therapy, and she has a very important specialty that we'd like to ask her about. So welcome, thank you for joining us.
Thank you for having me.
So what is your specialty here?
I am a pelvic health physical therapist. We work with the region of pelvis within the body, and as it relates to different organ systems.
Okay.
So within the pelvis, 3 very important organ systems intertwine.
Okay.
There are 3 organs in the pelvis: the bladder, bowel, the rectum, and the uterus.
Okay.
So we are dealing with 3 different systems: the gastrointestinal system, the reproductive system, and the urinary system. So the muscles, ligaments, nerves, and all the joints of the pelvis really affect what happens with all 3 of these systems.
That makes sense. Yes, and I did not know that. So when you're talking to your clients, I mean, we talk in our Pilates studio about the pelvic floor, but I think it can be very difficult for people to understand what the pelvic floor is because it's not a group of muscles like your bicep.
Yes.
So how do you explain it?
Can I show you?
Oh, please, yes.
Please, yes. Okay. So this is how I usually show people. This is the pelvis.
Okay.
This is the bone on the right, bone on the left.
Okay.
Right. This is the bone in the back, your lower back, your tailbone. These are the organs inside: bladder, uterus, rectum.
Okay.
So if we were to take the pelvis and like cut the top off, this is what we would see.
Okay.
Now, if you flip it over, this big muscle is pelvic floor.
Okay.
So basically, if you take all the organs out,
I did not know that was going to happen.
the big muscle inside, it basically looks like a basket.
Yes.
Right? It's a sling, it's a hammock that supports the organs, that supports all of the fascia, and when there's a baby, all of the baby inside this bowl. So it is very important for control of urination, control of bowel movement, and sexual dysfunction.
Okay. Wow. So do you find that it's mainly women who've had children who might have problems with the pelvic floor, or do all women sometimes encounter this, or is it specific to women who've had children?
No, all women and men will have pelvic floor dysfunctions at different stages in life. Pelvic floor dysfunctions really start at the childhood, adolescent ages. But yes, it is true that there are 2 different age groups, 2 different times in life when these problems happen more. One is pregnancy and one is menopause.
Okay.
Because these are the times when the hormones are really changing, and with the hormones, the pelvic floor function and the function of all of these 3 systems change a lot.
Interesting.
So due to how much trauma and how much change the pelvic floor and the system undergoes for 9 months, 10 months of pregnancy, it does take a toll. So we see a lot more of that, but it can happen anytime. It happens a lot in athletes actually, because they put so much strain through their body.
Of course.
That it would be surprising to know how many athletes actually have tiny little leaks through their marathons, through their gymnastic competitions, swimmers.
Wow.
Interesting. So it's something that I think, we talk to a lot of our female friends, and some of them just seem to think it's normal. That it's just something, it's just part of aging, and they just need to live with it. Do they really need to live with it?
No, absolutely not. No one needs to live with it. In fact, any of these dysfunctions, I mean, it really is a muscle at the end of the day, right? Would you live with your bicep hurting all the time?
No.
So it's just not visible. It's not right there for you to see, but it is just a muscle. Like, not just a muscle, it's a very important muscle, but it is, at the end of the day, it's a muscle. And it can be stretched, it can be strengthened, it can be trained, it can do so many things if you would just give it a chance and try to understand where and how.
Oh, wow, that's so fascinating, because I think a lot of people tend to think that oh, well, I'm older. If I sneeze and this happens, that's my lot in life.
Yeah.
Right.
And it's not. And I think we were speaking earlier, and you mentioned that some women tend to think other problems are normal and they're not, such as pain with intercourse,
Yeah.
and that tends to happen a lot.
Yes, pain with intercourse has been, I mean, I think in our culture for a very, very long time, and somehow this thing became a normal thing that if there's pain with pap smear, sometimes doctors are not sending people out for treatment because, oh, if you have pain with pap smear, you likely have a lot more pain with intercourse.
Right.
So, and that can be helped. That can absolutely be helped because again, if you were trying to lift your arm and you couldn't lift it, nobody would say, "Oh, this is how it's going to be."
Right. They would see a
Right?
physical therapist. They would take action.
They would try
yeah.
to fix it, but that doesn't seem to happen on the pelvic floor side of it.
Right. Do you think it's because there's a lack of understanding about the pelvic floor, or just there's this kind of like a
Societal,
taboo subject, or you know?
Yes, I think both. I don't know how many medical professionals, and there are so many medical professionals who are great, who are referring,
Right.
but a lot of medical professionals are not because
Right.
it wasn't in the curriculum, it wasn't in the protocol in earlier days, although that's been like at least 2-3 decades. The other thing also is that once the doctor or somebody like you tells a patient, a person, to go see a physical therapist, and somebody mentions there's going to be some internal work, sometimes the patient does not want to do that because they don't know.
Right.
They're like, I don't know what that means.
Oh,
Right.
Yes.
That
So-
makes sense. I
So a
can
lot-
see.
So I think a lot of it is education. We have to like all get out there, say, okay, this is a muscle. It's inside, yes, so it's harder to get to, but it's still a muscle. It's still
Right. Now, back in the day, I think the only thing that women knew was Kegel exercises. Did I pronounce that right?
Yes.
K-E-G?
Okay.
Good. Are
Everyone
those?
says differently. Some people say Kegels,
Okay.
Kegels. I don't know.
So I'll put the spelling up so that we can all know what it is. And are those effective?
They are effective if they're done right.
Ah.
1 out of 3 women will do their Kegels wrong, and there's a lot of research for this. They've
Okay.
tested random women of different age groups, and they've tested them. It's like, okay, 1 out of 3 of them don't know what they're doing. So one of the things, if you know that what Kegel is supposed to do, and somebody has checked, or you have checked, you should know how to check yourself, your body. Then yes,
Okay.
Kegels are good.
Okay, that's good to know.
Yes.
And is this age dependent? Can women of any age benefit from pelvic floor strengthening exercises or physical therapy if they need it? Or, we were wondering, is it something like, we're thinking of our mother. Our mother probably would never do it. But that aside, if you have a willing patient, is there a chance for success at any age, or is it sort of taper off?
So the chances of success are obviously like any other body part, is better when you're younger,
Right.
Because you have more buffer to
Right.
play with, right? You have different muscles that can compensate, and after menopause, estrogen does drop significantly.
Okay.
And with the drop of estrogen, there is natural loss of some muscle power in pelvic floor.
Okay.
So it is harder and that's one of the things that women who have kids, right? So they're 30, they have kid, and then they're leaking, but they're leaking a little bit here and there. They're like, okay, we can manage this. But that little bit leaking, as they get into their 40s and when they get 50s, all of a sudden now it's a lot of leaking.
Right.
And they say, we didn't do anything new. My kid was 20 years ago. It's like, well, 20 years ago you had a lot more buffer.
Right.
Now you don't. So I think it does tend to, the potential tends to get harder. So
Okay.
we say try to do PT right before menopause.
Okay.
So that you can build up right while you still have estrogen in your system. But having said that, I see postmenopausal women and almost all of them get better.
Okay.
They take longer,
Right.
they have to work harder, but they do get better.
Well, it's the same thing with just a regular muscle. If you aim to do something at past 50 or 55, it's going to take you a little bit longer to get there than it would have in your 20s.
Absolutely.
Right. It makes perfect sense when you say it, but I think too much in society, it's like, oh, well, this is my lot in life.
Yes.
And you see all those commercials for like the Poise pads or Depends for women and stuff. And so it's
Yeah.
sort of like sending the message.
Normalizing
Right.
it.
Yes, it
Yeah.
has. Definitely.
Normalizing it, and I think there's like a huge outcry in the pelvic floor world, at least in the PT world. It's like, don't normalize
Right.
incontinence. It's not like, okay, you can be beautiful in any shape. You can be healthy while you leak. That's not the same thing.
Right. That's a good point. Yeah.
Because they kind of sound like that,
Yeah.
that leaking is, okay, you can be leaking, but still be very functional. Well, not really.
That makes sense. So in the Pilates world, they are always cueing, they meaning a lot of Pilates instructors, and we as well pull up the muscles of the pelvic floor. Never once have I had a client say, what do you mean by that? So we usually say, like, what was the one instructor we had who had a very good pull up?
She said, like an elevator, she said it's like you have a tissue on the floor and you're trying to lift the tissue up with the muscles of your pelvic floor, which is a stretch image-wise. When she said that, I was like, that's an interesting image. I had not thought of that.
I would rather have that lifting image any day rather than squeeze.
Right. Okay, that makes sense.
Because a lot of times it's like squeeze. I don't know what squeeze does not do anything. Most of people just end up squeezing their buttocks.
Right.
Oh, right, okay.
Okay, that makes sense.
So if she's saying lift on, we kind of say
okay.
suck.
Okay.
Right? You know,
yeah,
okay.
That cue usually works, and cue also if the patient is sitting on the pelvic floor, it's better, easier for them to. So first few times when they're trying to understand it, if you can do internal, having them sit on that part while they lift, it's easier.
That makes sense.
It does make sense.
So is there anything else in your experience dealing with a wide range of women that you think is important that women know that you feel is a misconception?
I think in terms of Kegel, I think one misconception is that if you're leaking, that you need Kegel. Because if you are leaking, you don't always need Kegels.
See, and I didn't know that.
Yeah.
If you're leaking, there's one place where the muscles, and you would know if I draw a parallel with another muscle, it's very obvious. Like if bicep is weak, it's not going to be able to lift. Yes, you have to strengthen the bicep. But what if the bicep is tight and you're like stuck in this range of motion? You can't even straighten it. If you can't straighten it, obviously you can't lift it. There's nothing to lift.
Right.
So a lot of times, especially, doesn't happen so much with postpartum women after birth, but it happens a lot with athletes. They're not weak. They just have no flexibility of the pelvic floor. So sometimes they're leaking and doing Kegels and not getting better and thinking that, oh, this doesn't work. One of the times they're not doing it right, or that they actually don't need to do Kegels, or before they need to do Kegels, they need to actually have some flexibility in their pelvis and their hips and their pelvic floor, like different things. So one of the things that tends to happen is, just because you're leaking doesn't mean you need Kegel. You probably need to see a pelvic floor PT to find out why you're leaking.
Gotcha.
And from there you can do different things, but at least diagnosis is important.
Absolutely. I didn't know that the pelvic floor muscles could be stretched and strengthened, which is kind of, stupid if I think about it, because every other muscle in the body needs to be stretched and strengthened. But that is just one muscle that I never thought might actually need to be stretched as well.
But I think as a fitness professional, the pelvic floor tends to be taught as more of an involuntary muscle. But from what we're hearing from you, it actually can be trained voluntarily.
The thing is, somebody who has good form, who is in tune with their breath, who is in tune with how their body is sitting, pelvic floor is kind of automatic, right?
Okay.
Like you never thought about your breath.
Right.
Your breath
You don't have to
and your
think
pelvic
about
floor.
your diaphragm moving up and down.
But if you wear really tight jeans and you hold your stomach in, well, after doing that for 3 years, you probably have to think about your diaphragm. Because you trained it to not do that.
Right.
So I think in life, when we start to breathe we stop breathing properly, we stop standing properly, we sit too long, then pelvic floor stops becoming that automatic muscle it was supposed to be. Kids are not thinking about it. But then again, kids are not having back pain either.
Right.
They're not thinking about
Very
it.
well put.
Right.
They're just like, so an ideal state, everything will work fine. But just like shoulder or back pain will come because of life, because our life is not perfect, same thing, the pelvic floor.
Interesting.
We'll get that.
So we do a lot with sitting. Like we think sitting is the devil. And so it's interesting for you to link sitting too much also with the pelvic floor, because that's
absolutely.
that's actually good for us to know, because we've done a lot of workshops with what sitting does to the whole front line of the body. You're short, and I hadn't thought of the connection to the pelvic floor. So very important.
This has been extremely informative.
Thank you.
Yes. So thank you so much. We really appreciate talking to you.
Thank you.
Thank you. Wow, that was amazing. I learned so much.
I know. I was expecting to learn something, but I learned so much more than I thought I was going to, which is great. And actually, we want to go back because I know I want to know more about how the breath affects the pelvic floor.
Right, because she was calling it diaphragm, like we have a diaphragm here and then the pelvic diaphragm.
Yes.
And then the whole thing with athletes. Like, who knew that athletes had problems? I always think that they're just so strong they don't have problems with things like that.
But they do, and that was fascinating to learn. But I think the main takeaway that we can leave you with today is that if you're doing Kegel exercises, that you should think of drawing up, whether it's the hammock pulling up,
Sucking up the straw.
picking up the tissue. So don't
squeeze. No
Because-
squeezing.
No squeezing, because you end up squeezing your bum, which can lead to, well, it doesn't strengthen your pelvic floor, A, and it can lead to a tight lower back. So don't do that. But we can't wait to talk to Dr. Sharma again, and see you next time.